It's a good morning, right? Yes, sir. Tomorrow will be a better morning, right? Okay. Anyway, I want to thank my colleagues here, Senator Shaheen. She's been our leader here in the Senate on the ACA subsidies bill, along with Senator Duckworth, who couldn't make it today. And I want to thank Congresswoman Lauren Underwood for leading the charge in the House, and thank Whip Katherine Clark for being here as well. So we're here to talk about one of the biggest differences between Republicans and Democrats, and that is health care costs. It's one of the top issues, as we all know, facing American families. And for some reason, Republicans have been bound and determined for years to undercut the progress we've made in bringing costs down. Democrats know that the cost of health care is too high, and that's why bringing it down has been one of the cornerstones of our work over the past 4 years. The Inflation Reduction Act, which I wrote with a few other people helping, included Joe Manchin. The Inflation Reduction Act included tax credits that included that led to millions of new people getting affordable individual health insurance, and millions more seeing their premiums drop by an average of $800 a year. Many people now qualify for $0 premium plans. It's a great thing. It's a life-changing experience for families who can get their health care costs provided for. And there's no reason why we shouldn't make these tax credits permanent before they expire next year. So that's why Senator Shaheen and Congresswoman Underwood are introducing legislation to do just that. If we don't extend these tax credits, millions of families are going to see a massive tax hike that'll make their premiums far less affordable. These are everyday folks from every walk of life. A new study found that 1 in 7 Americans, that's a lot, have taken advantage of these tax credits at some point in the past decade. This is not a niche market. This is not just some small group. We're not against any small groups. But it's a major part of our health care system that ensures everyone has access to health care. We've made great progress in health care ever since President Obama, and ever since Democrats have had some real say. We don't want to move backward. There are 5 million Americans who could lose coverage completely. Millions more could see their premiums increase by more than 50%. Many are self-employed people, farmers, small business folks, who depend on these credits to purchase their health insurance. These enhanced credits reduce the uninsured rate among farmers, for instance, by 25%. That's a lot. That's a great deal. These are people who need a bridge until they're eligible for Medicare. With these enhanced tax credits, a 60-year-old couple in Ohio, jointly earning $80,000 a year, pays $566 a month to cover 2 people on the average plan. If the tax credits expire, instead of paying $566 a month, they'll have to pay $1,850 a month on the same plan. What are people like that supposed to do? They don't have millions of dollars, or billions of dollars like these, people who tend to fund the Republican super PACs. These are Black and Hispanic Americans who for too long have faced the worst health care in our country. Since the ACA, listen to this is great news, the uninsured rate among Black Americans and Hispanic Americans has been cut just about in half. This year, 5 million Hispanic Americans, 2 million Black Americans, 2.5 million Asian Americans, 200,000 Native Americans took advantage of these tax credits to buy coverage. So this should be a no-brainer. Whether it's us personally, a family member, a close friend, I doubt there are many Americans who don't know someone who's benefited from these credits if they haven't benefited themselves. But as we all know, Republicans have a long track record of attacking the ACA, doing everything in their power to roll back the progress we've made to bring down costs. And everyone here is well aware of Project 2025, the Trump fans' playbook for jacking up health care costs, even for people with chronic conditions. Ensuring health care coverage for Americans with pre-existing conditions is one of the most popular parts of the ACA. impacting about 129 million Americans. So it's just cruel, but all too typical that Republicans like Senator Vance would continue to target it. So make no mistake, Donald Trump, J.D. Vance may try to run away from Project 2025, but Americans know they own every single one of the proposals. It's their friends, their cohorts, people who hope to be into the government if, God forbid, Trump wins, who wrote it. And they say that's what we're going to do. Democrats now believe the time is to make health care more affordable for middle-class folks, especially people with pre-existing conditions, not to impose a tax increase on them. So we'll fight to make these tax credits permanent, and just like our fight to preserve ACA, to negotiate lower drug prices and cap the cost of prescription drugs at $2,000 a year for seniors, we are going to keep fighting until we win. Are you next? Okay, and now let me introduce our great whip in the House, soon to be majority whip or whatever happens. Leader, that's how it works over there. I remember from my 18 years. Katherine Clark.
Thank you, Mr. Leader. Thank you so much, Leader Schumer, and to our bicameral ACA champions. It is a pleasure to be here with Senator Shaheen, a fellow New Englander and neighbor, and what a pleasure to be here with our champion of healthcare in the House, Congresswoman Lauren Underwood, who is also a valued member of our House Democratic leadership. And we thank you for all your work on the ACA and healthcare, and also for the very successful hearing exposing Project 2025 you were critical in putting together yesterday. But what we have today is the perfect illustration of two very starkly different agendas that have been presented to the American people. From the Democrats, an offer to preserve, strengthen, and expand access to health care. A proposal that would prevent 5 million Americans from losing their insurance next year. The Republican offer? Repeal the ACA. Don't just kick those millions of Americans off their insurance, those 5 million, but 21 million people who currently get their health care through the ACA. Don't just take my word for it. Donald Trump has said it was a low point of his presidency that he failed to repeal the ACA. Not the global pandemic, not the insurrection at our Capitol, not the crimes he committed. His biggest regret is that he failed to tear away health care from the American people. And now he'd like the opportunity to take another run at it. Well, we're not going back. We're not going back to a less healthy and less just America. We're not going back to an America where being a woman is a pre-existing condition, where health care is treated like a privilege. We are going forward to a future where health care is upheld as a fundamental human right that it is. And I am so proud to stand with my Democratic colleagues, House and Senate, as we move forward together into the future. And I am so grateful for the work of Senator Shaheen on all of this and for being such a champion for access to health care for American families.
Well, thank you very much, Katherine. It's nice to join you this morning and Senator Schumer and Congresswoman Underwood to talk about what we need to do to make the Affordable Care Act premium tax credits permanent. Let me also recognize Senator Baldwin, who is a co-sponsor of the legislation. Our bill, our bicameral bill, the Health Care Affordability Act, would make tax credits more generous for those who are already receiving existing tax credits, and it would expand eligibility to consumers with incomes over 400% of the federal poverty level. So that's what the bill would do. We included it, as Senator Schumer said, in the American Rescue Plan, which extended those tax credits through 2022. We extended them again in the Inflation Reduction Act through December of 25, but in order to give insurers the ability to set their rates for the next year, we need to get this done in the first quarter of next year. So that means we need to get it done now. Medical costs are the top cause of bankruptcy, and we've got to do more to help people. People like Nancy Glenn, my constituent from Sutton, New Hampshire. Nancy was a self-employed, independent contractor. She couldn't afford to purchase health insurance because the premiums were just too expensive. So for 4 years, she never went to the doctor, even though she knew there was something wrong. Finally, she got a job which would give her health insurance, and she was able to go see a doctor and discovered that she's got type 2 diabetes. Now, because she finally got the care that she desperately needed, her diabetes is now under control. She's lost 80 pounds. She can keep up with her 10-year-old son, Hunter, and she's spending more time with her family, living a better, healthier life. But as we've heard, if we fail to extend these tax credits, 20 million Americans will see a sudden spike in their health insurance costs. 5 million people will become uninsured, and families like Nancy's would be faced with impossible questions like, do I postpone needed care because it's too expensive? Do I skip refilling my prescription because I can't afford it? Do I get that MRI or mammogram or other tests and just hope that the health care issues go away? Sadly, these aren't hypotheticals. As Nancy experienced, these are challenges that millions could face if we let these tax credits expire. And it wouldn't just affect families like Nancy's in New Hampshire. Red states, blue states, purple states are all home to families who would be forced to face skyrocketing costs. And the predictions are very clear. There's no ambiguity. Premiums would spike in every state, more people would be uninsured, and Americans would be priced out, too many Americans would be priced out of getting vital health care coverage. So it's why we made sure these tax credits were included, as I said, in the American Rescue Plan and the Inflation Reduction Act, and now it's time we do it again. The people we serve deserve better than the concepts of a plan. They deserve a real plan. That's what our bill would do. We need to follow up with real action. We need to get this done before it's too late. So, Congresswoman Underwood, I'm so pleased to be able to join you in this effort.
Thank you. Well, good morning, everyone. Thank you all for joining us today. It's an honor to join Leader Schumer and Whip Clark and Senator Shaheen for the introduction of the Healthcare Affordability Act of 2024. Now, today is one of my favorite days in Congress because today is a healthcare day. And from my very first day in Congress, it's been my mission to lower out-of-pocket healthcare costs for families across the country and in my community in Northern Illinois. That's why I first introduced the Healthcare Affordability Act in 2019. And I fought so hard to get a short-term version of it included into law. Because of this legislation, more Americans than ever before have access to quality, affordable health care through their marketplace plans. And since this legislation was signed as part of the American Rescue Plan and later extended in the Inflation Reduction Act, we've seen a record-breaking expansion of enrollment. In fact, earlier this month, we crossed 50 million Americans who have enrolled. That's 1 in 7 Americans who have benefited, who now have quality, affordable health care. And 4 out of 5 enrollees can get a plan for $10 or less a month. This legislation works. It's lowering costs, and it's bringing the peace of mind that comes with quality care to millions of people. And now we have to make these savings permanent. Because, and I want to be clear, this isn't about just adding numbers to the board. These savings are a difference between families having coverage and going without it. It's about making sure that families don't have to worry about their wallets when they get sick, and their kids are given an opportunity to live healthy and full lives. It's about creating an America where healthcare coverage is accessible and it's affordable for everybody, regardless of where you come from. And if we don't act now to extend these savings, families will see sharp and harmful premium increases for 2025. That's a fact. okay? The progress that we've made will be lost, and the consequences will be life-threatening. At a time when so many families are struggling to pay for the essentials, going backwards on all the progress that we've made on healthcare affordability is not acceptable. Not only do these savings help relieve the burden on families who pay exorbitant premiums, they're also a crucial tool in promoting health equity. The uninsured rate for Black and Hispanic adults has long been disproportionately higher than the rate for white adults. But this policy is changing that, as Leader Schumer said. From 2020 to 2023, enrollment across Black consumers has skyrocketed. Rural communities like parts of mine in northern Illinois have seen an explosion in coverage as these savings have made quality, affordable care available. We can't just pull the rug from under these families. Fundamentally, healthcare is a human right, and right now we have an opportunity to meet the moment and make high-quality care affordable and accessible for all. I am so excited that our leaders in the House and in the Senate understand the importance of this issue. It's clear that as Democrats, we are united in our mission to lower healthcare costs for the American people. Now is the time for the Congress to deliver on this promise to the American people. Now is the time to pass the Healthcare Affordability Act, and now is the time to make these savings permanent. Thank you.
Thank you very much, Congresswoman Underwood. I think we'd be happy to answer any questions that folks have. Yes. Will you just tell us what publication you're with?
Of course, Zach Blunt from Bloomberg. Do you expect to bring this bill up this year, or is this more something that you will funnel into the first quarter?
Well, I think it would be important to bring it up this year because we don't know what's going to be moving next year. And hopefully, before the end of this session, after the election, we will see a package of tax extenders or a tax package that will be included with the budget, and that would be an opportunity to include this.
Yes.
Yes.
Board member CNN, has Leader Schumer committed to bringing this to the floor in the next several months?
I think we are hoping that it will be included as part of a tax package. Yes. Yeah, tell me what your name is.
I'm Samantha Jones with the Washington Examiner, and I know you're on the Senate Foreign Relations Committee. I'm wondering, there's been a lot of reporting about the Middle East on the brink of an all-out war. Are there ways that you guys are going to be monitoring this in the next 5 weeks while you're at home? Is there plans, to be able to, be briefed remotely if something were to happen?
I think we will be briefed remotely if something were to happen, and I think everyone who's on the Foreign Relations Committee and really everyone in this Congress are watching with great concern about what's happening in the Middle East, the potential expansion of the war into Lebanon. Thank you all very much.
Thank you.
Thank you. That's
so much.